J shot are understandably a little concerned now. Our Justin Schreier explains the signs to watch out for.
First off, doctors say it is extremely rare to get that type of adverse reaction. We're talking about just 6 cases out of more than 6.8 million shots. As the nation hits the pause button on Johnson & Johnson's Janssen COVID-19 vaccine, health officials across the triad and the state say this is a very rare occurrence.
There have been 6 reported cases of this rare blood clot, which was also seen in combination with low levels of blood platelets. This is a very different and rare type of blood clot and needs to be treated differently.
Federal officials say they are reviewing those cases, which occurred in women between the ages of 18 and 48, 6 to 13 days after they were vaccinated. And while this pause can be alarming to some, Dr. David Priest says it shows that the safety system is working.
And that development should reassure us that anytime there's a safety signal or a sign that there could be a safety issue with a vaccine, the CDC and FDA diligently monitor the safety of those vaccines.
But what should you do if you've already gotten one of the Johnson & Johnson shots in the last several weeks? Health officials say you should look for these signs.
People who have received the Johnson & Johnson vaccine and who develop severe headache, severe abdominal pain, leg pain, or shortness of breath within 3 weeks of their vaccination should contact their healthcare provider and let them know that you've had the J&J vaccine.
And while federal officials dig into the data, the state says they will pause the use of the Johnson & Johnson vaccine until that process is complete and recommendations are made.
COVID-19 vaccines remain the most effective way to end this pandemic by preventing the spread of COVID-19, preventing hospitalizations and death.
And it's important to note that the Pfizer and Moderna vaccines are both mRNA vaccines and are not affected by this pause. The J&J shot is a viral vector vaccine. Justin Schreier, WXII 12 News.
Justin, thank you. So if you have received the Johnson & Johnson shot in the last few days, you may experience some common side effects that include pain, redness, or swelling in your arm at the location where you received the shot. You could also experience some tiredness, headache, muscle pain, chills, fever, and nausea. These side effects typically go away within about a day or 2 of getting that shot. Side effects might impact your ability to do daily activities, but they should go away again in just a few days at the most.